In the United States, the very ground beneath your feet can dictate the trajectory of your life. From the air you breathe to the opportunities your children will seize, the political alignment of your state, whether it leans red, Republican, or blue, Democratic, is far more than a mere electoral map. It reflects deeply divergent philosophies that manifest in measurable differences across life expectancy, public safety, educational attainment, economic prosperity, healthcare access, and the broader quality of life. This script embarks on an analytical, informative, and thought-provoking journey to dissect these disparities. Our purpose is not to declare a definitive winner, but to provide a balanced, data-driven examination of where each political alignment excels and where it faces significant challenges, encouraging a more nuanced understanding of the complex tapestry that is modern America. The terms red states and blue states have become shorthand for the nation's political polarization. Yet beneath these labels lie distinct policy choices, cultural norms, and economic structures that profoundly shape daily life. This exploration aims to move beyond partisan rhetoric, focusing instead on the tangible outcomes of these differing approaches. We will compare these differences with real data, examining the strengths and weaknesses inherent in each model. This isn't about assigning blame or celebrating one ideology over another. It's about understanding the lived realities of millions of Americans. By examining the data objectively, we can begin to grasp the profound implications of state-level governance on individual well-being and societal progress. What does it truly mean to live in a state that prioritizes individual liberty versus one that emphasizes collective welfare? Life expectancy is a powerful indicator of a population's overall health and quality of life. It encapsulates factors like healthcare access, environmental quality, lifestyle choices, and socioeconomic conditions. The disparities between red and blue states in this crucial metric are striking and consistent. According to 2021 CDC data, blue states consistently rank higher in longevity. Hawaii leads with 80.7 years, followed closely by California at 80.6 years, and New York and Massachusetts both at 79.9 years. These states often boast robust public health infrastructures, higher rates of health insurance coverage, and policies that support healthier lifestyles. Conversely, many red states lag significantly. Mississippi records a life expectancy of just 71.9 years, West Virginia 72.8 years, Louisiana 73.1 years, and Alabama 73.2 years. These lower figures often correlate with higher rates of chronic diseases, less access to preventative care, and socioeconomic challenges that impact health outcomes. The gap is not merely statistical. It represents years of life lost for individuals. The gender gap in life expectancy also reveals interesting patterns. In every U.S. state, women live longer than men, with an average difference of 5.8 years nationally. However, this gap is not uniform across the political spectrum. In blue states like Utah or Colorado, the gap tends to be smaller, around 4 years. This suggests that men in these states may benefit from better access to healthcare, safer working conditions, and perhaps less engagement in high-risk behaviors. The emphasis on public health and accessible services appears to benefit all demographics. In contrast, red states such as New Mexico or West Virginia exhibit a wider gender gap. This widening reflects systemic issues that disproportionately affect men, including higher rates of occupational hazards in industries prevalent in these regions, less engagement with preventative healthcare, and potentially higher rates of substance abuse. The data points to a clear benefit for blue states in fostering environments where both men and women can achieve longer, healthier lives. The issue of public safety, particularly gun violence, is a deeply contentious one. Yet the data presents a stark picture. According to CDC data from 2022, gun death rates show a significant contrast between red and blue states. Mississippi leads with 33.9 gun deaths per 100,000 people, followed by Louisiana at 29.1, Wyoming at 28.3, and Missouri at 25.3. These states often have more permissive gun laws and higher rates of gun ownership. The human cost of these statistics is immense. impacting families and communities daily. In stark contrast, blue states demonstrate significantly lower rates. Massachusetts records 3.4 gun deaths per 100,000, New York 4.1, Hawaii 4.5, and California 8.5. These states typically implement stricter gun control measures, which proponents argue contribute to fewer fatalities. The debate over gun rights versus public safety is vividly illustrated by these numbers. Beyond gun violence, overall violent crime rates also tend to be higher in many red states. New Mexico, for instance, reports 778 violent crimes per 100,000 people, with Tennessee and Arkansas both at 672. These figures encompass a range of offenses, from aggravated assault to robbery. Conversely, blue states like Maine, 108 per 100,000, and New Hampshire, 146, exhibit significantly lower violent crime rates. This disparity often correlates with differing approaches to law enforcement, community investment, and social support systems. The perception of safety and the reality of it varies dramatically. The U.S. has the highest incarceration rate globally, and red states frequently lead in prison population per capita. Oklahoma, Mississippi, Louisiana, and Arkansas consistently rank among the highest for incarceration rates. This reflects a punitive approach to justice, often characterized by longer sentences and less emphasis on rehabilitation. In contrast, Massachusetts, Connecticut, and New Jersey rank among the lowest. These states often pursue alternative sentencing, invest in crime prevention programs, and focus on reducing recidivism. Furthermore, murder rates also trend higher in red states. From 2021 to 2022, red states had on average 33% more murders than blue states. This data suggests that different policy frameworks yield different outcomes in public safety and criminal justice. Mental health is a critical component of overall well-being, and suicide rates offer a grim insight into societal distress. Suicide rates are notably higher in rural and red-leaning states, often linked to factors like social isolation, limited access to mental health care, and economic hardship. Wyoming records 32.8 suicides per 100,000 people, Montana 30.5, Alaska 29.9, and New Mexico 26.3. These states often face challenges in providing comprehensive mental health services, particularly in vast, sparsely populated areas. The cultural emphasis on self-reliance can also sometimes deter individuals from seeking help. In stark contrast, blue states like New Jersey, 8.1 per 100,000, New York, 8.3, and Massachusetts, 8.6, report significantly lower suicide rates. These states often have more robust mental health infrastructures, greater public awareness campaigns, and more accessible support networks. The data suggests a clear benefit for blue states in addressing mental health crises. Cancer and heart disease remain the leading causes of death in the U.S., and mortality rates for these conditions also vary by state alignment. These differences often reflect disparities in lifestyle, access to preventative care, and environmental factors. Kentucky, a red state, records a high cancer mortality rate of 174.2 per 100,000 people. Mississippi, another red state, has a high heart disease mortality rate of 231.4 per 100,000. These states often struggle with higher rates of smoking, obesity, and less access to early detection and treatment services. Conversely, blue states generally show lower mortality rates. Massachusetts has a cancer mortality rate of 137.5 per 100,000, and California a heart disease mortality rate of 150.8. These states often benefit from more comprehensive public health initiatives, greater access to specialized medical care, and populations with healthier overall habits. The investment in public health infrastructure appears to yield tangible benefits in reducing these critical health burdens. Education is a cornerstone of individual opportunity and economic development. The level of educational attainment within a state significantly impacts its workforce, innovation, and overall prosperity. The data reveals a clear advantage for blue states in this area. In 2022, Massachusetts led the nation with 45.0% of its adults holding bachelor's degrees, followed by Colorado at 43.2% and New Jersey at 42.6%. These states typically invest heavily in public education, from K-12 to higher education, and often have strong research universities that attract talent. In contrast, Mississippi reports only 22.2% of adults with bachelor's degrees and West Virginia 21.6%. While some red states are making strides in specific areas, such as Mississippi's gains in early literacy, overall graduation rates and public school rankings generally favor blue states. This disparity reflects differences in educational funding, teacher salaries, curriculum choices, and societal value placed on higher education. The long-term implications for economic competitiveness and social mobility are profound. Economic well-being is a critical determinant of quality of life. Median household income and poverty rates offer insights into the economic health of a state's residents. Here, blue states generally demonstrate higher levels of prosperity. In 2022, Maryland reported the highest median household income at $97,332, followed by New Jersey at $96,346 and California at $91,551. These states often have diverse, high-tech economies, strong labor markets, and higher-paying industries. While the cost of living is also higher, the earning potential is significantly greater. Conversely, Mississippi has the lowest median household income at $52,719 and Arkansas at $53,550. These states often rely on traditional industries, have lower wages, and face challenges in attracting high-growth sectors. Consequently, poverty rates are also higher in many red states. Mississippi leads with an 18.8% poverty rate, and New Mexico at 18.1%. In contrast, New Hampshire boasts a low poverty rate of 7.1%, and Utah, a red state, but one with a rapidly diversifying economy, is improving at 8.2%. The economic models favored by blue states, often involving more regulation and the social safety nets, appear to correlate with higher overall income and lower poverty. Access to affordable healthcare is a fundamental human right for many, and a significant policy differentiator between red and blue states. The uninsured rate is a key metric in this regard. In 2022, Texas had an uninsured rate of 16.6% and Oklahoma 14.3%. Many red states have resisted expanding Medicaid under the Affordable Care Act, leaving millions without health insurance coverage. This often results in delayed care, higher emergency room visits, and poorer health outcomes for their populations. Massachusetts, on the other hand, has an uninsured rate of just 2.5%, and Vermont 3.0%. Blue states largely embraced Medicaid expansion and often have state-level initiatives to ensure broader coverage. This commitment to universal or near-universal healthcare access significantly impacts the health and financial stability of their residents. The philosophical divide over the role of government in healthcare is clearly reflected in these numbers. The issue of abortion access is one of the most contentious and philosophically charged divides in American politics. The legal landscape surrounding abortion has shifted dramatically, particularly since the overturning of Roe v. Wade. In 2023, New York, a blue state, had an abortion rate of 29.6 per 1,000 women, reflecting greater access to reproductive healthcare services. Florida, a red-leaning state, had a rate of 20.5, indicating a more complex and evolving legal environment. In stark contrast, Missouri reported a rate of 0.1 and South Dakota 3.5 due to near-total bans or severe restrictions. Blue states generally maintain or expand access to abortion, viewing it as a fundamental aspect of reproductive freedom and healthcare. Red states, driven by pro-life convictions, have enacted strict bans or severe limitations. It's important to note that higher abortion rates in blue states are tied to access, not necessarily more pregnancies. Women in states with bans may travel to states where abortion is legal. This issue highlights a profound philosophical divide over bodily autonomy, moral values, and the role of the state in personal medical decisions. Beyond abortion, the broader landscape of women's rights and gender equality also shows significant divergence. The Georgetown Women's Peace and Security Index 2024 provides a comprehensive look at the best and worst states for women. Massachusetts, Connecticut, and Minnesota, all blue states, consistently rank among the best. These states often have stronger protections against discrimination, better access to childcare, more equitable pay laws, and policies that support women's economic and political participation. They tend to foster environments where women have greater opportunities and fewer systemic barriers. Conversely, Mississippi, Arkansas, and Alabama, all red states, rank among the worst. Women in these states often face higher maternal mortality rates, less reproductive freedom, and fewer legal protections against gender-based discrimination. The differing approaches reflect fundamental disagreements on gender roles, family structures, and the extent to which government should intervene to ensure equality. Racial inequality remains a persistent challenge across the U.S., and its impact is starkly visible in life expectancy disparities. While the national average shows significant gaps, Asian Americans at 84.5 years, Hispanic at 80.0, white at 77.5, Black at 72.8, and Native American at 67.9. These gaps are often exacerbated or mitigated at the state level. States like Wisconsin and Washington, D.C. show particularly stark Black-white life expectancy gaps, highlighting localized systemic issues. Blue states generally tend to invest more in minority health initiatives, address social determinants of health, and implement policies aimed at reducing racial disparities in healthcare access and outcomes. This focus on equity, while not always perfectly executed, often leads to better outcomes for marginalized communities. Even seemingly mundane aspects of daily life, like driving, reveal differences. Traffic deaths per 100 million vehicle miles traveled show a clear pattern. According to NHTSA 2022 data, Mississippi leads with 1.90 fatalities, followed by South Carolina at 1.88 and New Mexico at 1.83. Red states often experience more deadly car accidents, which can be attributed to factors such as longer rural commutes, less stringent enforcement of traffic laws, lower seatbelt usage rates, and less investment in road infrastructure improvements. In contrast, blue states like Massachusetts, 0.54 fatalities, New York, 0.76, and California, 1.06, have significantly lower rates. These states often have more comprehensive traffic safety campaigns, stricter enforcement, better maintained roads, and a greater emphasis on public transportation, which reduces overall vehicle miles traveled. The data suggests a tangible benefit in terms of public safety on the roads for blue states. The safety of one's workplace is another critical aspect of quality of life, and here too, a pattern emerges. The occupational death rate per 100,000 workers highlights differing regulatory environments and industry compositions. In 2022, Wyoming reported a high occupational death rate of 13.0, followed by Alaska at 10.5 and North Dakota at 10.0. These red states often have economies heavily reliant on riskier industries such as mining, agriculture, and oil and gas. They also tend to have looser labor regulations and less robust enforcement of workplace safety standards. Conversely, blue states like Massachusetts, 1.8 fatalities, and New Jersey, 2.1, demonstrate significantly lower rates. These states typically have stronger OSHA enforcement, a greater presence of labor unions advocating for worker safety, and economies that are more diversified away from high-risk sectors. The emphasis on worker protection and regulatory oversight appears to yield safer working environments. While the data often points to blue states excelling in many quality-of-life metrics, it's crucial to acknowledge areas where red states offer distinct advantages, aligning with different sets of values and priorities. This is where the balance of our analysis truly comes into play. For many Americans, faith and tradition are central to their lives. Red states often embody these values more prominently. Pew Research data on church attendance shows significantly higher rates in red states. Mississippi reports 74% weekly church attendance, and Alabama 73%. These states often have strong community ties built around religious institutions and a cultural emphasis on traditional family structures. For individuals who prioritize religious freedom, community faith, and conservative social values, red states may offer a more aligned and supportive environment. In contrast, blue states like Vermont, 31%, and Massachusetts, 33%, have much lower rates of religious observance. Red states also demonstrate a strong commitment to military service and patriotism. Military enlistment rates are consistently highest in southern states. Georgia, Texas, South Carolina, and Alabama are significant contributors to national defense and foster a strong military culture. These states often have a deep-seated respect for service members and a robust presence of military bases and veteran communities. For those who value military tradition, national service, and a strong sense of patriotic duty, red states often provide a more resonant cultural landscape. One of the most tangible benefits of living in a red state is the significantly lower cost of living. This is particularly evident in housing and daily expenses. Mississippi, Arkansas, and Oklahoma consistently rank among the lowest in terms of overall cost of living. This affordability can translate into greater financial freedom, the ability to own a home, and a less burdensome daily existence for many families. While blue states like California, New York, and Massachusetts offer higher wages, they also come with exorbitant housing costs and a higher price tag for everyday necessities, often negating the benefit of higher income. For those prioritizing financial accessibility and a lower barrier to entry for homeownership, red states offer a clear advantage. Red states often champion a philosophy of minimal government intervention, promoting low regulation and tax-friendly policies. This approach is designed to foster business growth and individual economic freedom. States like Texas, Florida, and Tennessee are often lauded for their business-friendly environments, attracting entrepreneurs and corporations with lower taxes, fewer bureaucratic hurdles, and less stringent labor laws. This model appeals to those who believe that economic prosperity is best achieved through free markets and reduced government oversight. In contrast, blue states tend to invest more in labor rights, environmental protection, and public services, which often come with higher taxes and more regulations. While these policies aim to create a more equitable and sustainable society, they can also be perceived as burdensome by businesses and individuals seeking maximum economic autonomy. The trade-off between collective well-being and individual economic liberty is a core philosophical difference. The data paints a complex and often contradictory picture of the American landscape. Statistically, blue states tend to outperform in metrics related to life expectancy, education, income, healthcare access, and various aspects of public and workplace safety. Their policy frameworks often emphasize collective well-being, social safety nets, and robust public services. Conversely, red states offer distinct advantages in terms of affordability, a strong emphasis on traditional values, a vibrant religious life, a culture of military service, and a commitment to business freedom and personal liberty through lower regulation and taxes. Their policy frameworks often prioritize individual autonomy, free market principles, and a more limited role for government. The choice of where to live, therefore, is not merely a political one. It's a deeply personal decision rooted in what you value most. Do you prioritize comprehensive social services and a higher quality of life as measured by health and education outcomes, even if it comes with a higher cost of living and more regulation? Or do you value affordability, individual liberty, and traditional community values, even if it means fewer public services and potentially different health and safety outcomes? This deep dive reveals that there is no single best state or political alignment for everyone. The trade-off between autonomy and access, between individual freedom and collective well-being, is clear and present in the lived realities of Americans. Understanding these differences, rather than simply dismissing them, is crucial for fostering informed dialogue and making choices that align with your personal vision of the good life. Where would you feel most at home? What values truly guide your decision? We encourage you to reflect on these insights, engage in respectful discussion, and share your perspectives. Your informed participation is vital to understanding the diverse fabric of our nation.